we know that allogeneic stem cell transplantation is now a pivotal part of the management plan of many adults with acute myeloid leukemia. And what is proving to be particularly exciting is the emergence of targeted therapies are demonstrating a real opportunity to improve outcomes post-transplant, particularly with regard to the risk of disease relapse. So one of the most promising areas is in the area of FLT3 inhibition, and there are now 2 randomized studies using Sorafenib as maintenance post-transplant in patients allografted for FLT3 positive AML, in which a survival benefit was shown in patients who received Sorafenib maintenance. So one of the challenges about Sorafenib is it's not very well tolerated, and so it's exciting that the Morpho study using Gilteritinib, a much better tolerated FLT3 inhibitor, closed about 2 years ago, and we hope will be answering the question whether Gilteritinib maintenance improves outcome. The other area where there's real excitement is the use of and the impact of Venetoclax, a BCL2 inhibitor, in improving the number of patients who can get to transplant. So there's now really good evidence in older patients that the CR rate can be equivalent to what you see with intensive chemotherapy, and it's possible that patients who achieve CR after Venetoclax and azacitidine may have a better MRD response, and secondly, they may actually have tolerated the induction chemotherapy better than intensive therapy and therefore have a better transplant outcome. And certainly groups such as Daniel Palia's demonstrate in those patients who did achieve CR and were fit enough to transplant using Veneza very encouraging transplant outcomes. And then Venetoclax in combination with azacitidine is also being looked at as a maintenance therapy, and there's a study called VIALE-T, which is now recruiting. Again, it's a simple principle. Patients allografted for AML in first remission receive azacitidine and Venetoclax maintenance for up to 2 years. So I think we will see increasingly the use of other targeted therapies with the potential to augment the graft-versus-leukemia effect. Siramadlin is an MDM2 inhibitor with that potential, but also strategies perhaps to reduce the risk of graft-versus-host disease whilst preserving a GvHD effect. So I think it's an exciting possibility, and I don't believe that we should be living in a Manichaean universe where it's one or the other. It's thinking about how you use targeted therapies to improve outcomes of transplant and potentially reduce its toxicity.